Um, I'm very excited to be presenting today to you all. I've been collaborating with students against superbugs and specifically with Daniel for a while, and I'm a big fan of the work that he's doing around advocacy and raising awareness on antimicrobial resistance. And today, I've been asked to talk about the social and economic implication of AMR and the disproportionate burden in low resource settings. So I'm actually going to start with a short story about how the first antimicrobial chemotherapy was discovered. So that was at the beginning of the last century, and the discovery was made by a German doctor. He discovered this compound that had an activity against pathogen, and he successfully used this compound to treat syphilis. So this compound that which actually made with arsenic was used at the beginning of the 19th century to treat people with syphilis. And he labeled these compounds the magic bullet, and the reason why I call it this way, because he was able to specifically target the pathogen within the host without actually killing the host. And so with the then later discovery of antibiotics in 1928, and then the production of antibiotics from 1945, antibiotics have been seen and have been actually used as bullets, as magic bullets. So the actual discovery of antibiotic has been a revolution, because all of a sudden you had compounds, you had drugs that were specifically active to destroy bacteria or other pathogens. And this gives you a sense of the implications around the use of antibiotics, but also the understanding at the societal level that we have around the use of these drugs, as well as the expectations that is being created within communities about having the ability to access these drugs that are effective to treat infections. And so basically, we grew up literally in a society where we understand and we're used to have access to antibiotics or antimicrobials that are successfully able to treat infections. However, since basically the discovery of antibiotics, we soon realized that bacteria and other pathogens can develop a resistance to antimicrobials, which means that antimicrobials are no longer effective in treating and destroying the bacterial pathogens that were used for at the beginning. And so we soon realized that antibiotics, antimicrobials, in reality, they are not magic bullets. They cannot be used for everything, and in the future, they not might be as effective as they used to be in the past. And so if we look at antimicrobials in general, the impacts of the use of antimicrobials, it's actually quite different compared to the use of other drugs. So if you think about, for instance, insulin, when a diabetic patient uses insulin, the effect of insulin is only it will only affect the person, the individual. It will not have an effect on the entire community and population. Instead, when you use an antibiotic, the effects is seen at the level of the community. And the reason being because the antibiotic treats an infection that can potentially spread among the community. And in the moment you treat this infection, then you prevent the infection from spreading. So the effects that you have around the use of antibiotics are much broader than any other drug. And so you use antibiotics to treat infections in humans, but antibiotics are also being used to treat infections or prevent infections in other sectors. And so antibiotics have been used in agriculture, they've been used in veterinary medicine, and the effects of the use of antibiotics in those different sectors have been seen in all the different environments and reservoirs, which means that the use of these drugs needs to be tightly controlled because the effect is not just an individual effect, but is a very, very broad effect. So just to give you a scale of the burden of antimicrobial resistance nowadays, at the beginning of this year, a work was published in the Lancet, which finally put numbers to the burden of antimicrobial resistance. There were around in 2019, there were around 1.5 million deaths that were directly attributable to antimicrobial resistance, and around 5 million deaths that were associated with antimicrobial resistance. So the primary cause of death in this case was not antimicrobial resistance, but the patients were they were affected by antimicrobial resistant infections that were resistant, they were not responding to antimicrobials. So if we look at the distribution of the AMR burden, it's actually quite striking. And you see from this graph that sub-Saharan Africa is actually one of the most affected regions in the world. Not only, however, you can see that not only low middle income countries are affected by antimicrobial resistance, but also high income countries. So if you look at numbers within Central Europe, also numbers in Central Europe are quite high, specifically in the southern parts of Europe. So the problem is not only a problem that affects low middle income countries, but it also affects high income countries. And it could potentially become worse. We just have to remember that these data are actually estimates. And so the issue could be even worse than what was measured in this work. So how did we get at this stage? So I mentioned that when you use antimicrobials or antibiotics, the effect that you have is not an individual effect, but you have an effect on the entire community. So how did we get here? And so the question to ask is, when might an antibiotic do more harm than good? So antibiotics do more harm than good when they're used for viral conditions. Again, antibiotics do not treat viruses. Antibiotics are not useful to be used as growth promoter, and they've been used for many years, and it continues to be used as growth promoters in animal farming. And the antibiotics are found in the environment, and they're found in the environment due to different practices, the use of antibiotics in farms, but also the release of antibiotics in wastewaters coming from hospitals or coming from manufacturing facilities, pharmaceutical manufacturing facilities. Also, using the wrong type of antibiotic to treat a specific infection can cause the spread of and the rise of antimicrobial resistance. Using the wrong dose for the wrong number of days can cause antimicrobial resistance, and compliance, patient compliance with treatments and patient behavior also can cause antimicrobial resistance. So specifically patients not taking the full course, the full prescribed course of antibiotics. So taking all this together, antimicrobial resistance really looks like the perfect storm. So I'm going to give you some key facts around antimicrobial resistance. So experts say the antimicrobial resistance will impact on GDP, will impact on poverty, will impact on world trade, will impact on healthcare costs, and will impact on livestock and consequently on food security. And if you think about all these key facts related to antimicrobial resistance, then it's quite clear that we're already seeing something similar during the COVID-19 pandemic. And so we were really able to appreciate during the pandemic the impact that spread of an infectious disease can have on the world population. And we've seen all of this. We've seen countries struggling, health systems struggling in high-income countries and low middle-income countries, struggling with responding to the pandemic. We have seen trade being affected because of the difficulty of traveling during the pandemic, but also the amount of people that were affected by the disease. COVID-19 has definitely had an impact on poverty. People lost jobs because of COVID-19. A lot of businesses were closed during confinements, and they were unable to reopen when confinements ended. The healthcare costs have spiraled, and this is because very quickly hospitals had to pivot their resources to treat patients with COVID-19, and we've seen the effects on doctors and other healthcare professionals that this had, and also resources and lack of resources in the healthcare system trying to respond to the pandemic. And the pandemic finally also affected the availability of foods because of supply chain interruption and food security as well. So if we think at what could happen in the future, there are a lot of things that we have taken for granted because of the availability and efficacy of antibiotics. For instance, surgical procedure, they routinely use antibiotics, which means that routine surgical procedures and minor infections as well. Think about it, the infection could become life-threatening, or childbirth as well could become life-threatening. Global travel could become too risky, and we've seen that with COVID-19. There are estimates that the global GDP could fall by 3.8%. And also, as there will be people affected by antimicrobial resistance, and this means that there could be more deaths or disability caused by it. And I also think that we should mention that antimicrobial resistance has not stopped during the COVID-19 pandemic, although a lot of resources have been pivoted to respond to the pandemic. Antimicrobial resistance has kept spreading, and so a lot of experts are now worried that the COVID-19 pandemic has been concealing antimicrobial resistance and the continuous spread of antimicrobial resistance on the global level. So this one just gives you a really brief overview of the different actions that have been taken globally to respond and to stop the spread of resistant infections. A lot of these actions have been coordinated by the World Health Organizations, the Food and Agriculture Organization, and the World Animal Health Organizations. And most recently, the United Nations Environmental Program has also joined the tripartite, recognizing the importance of One Health approach, so recognizing the importance of the environment also in the spread of antimicrobial resistance. Activities have picked up against antimicrobial resistance have picked up in 2016 when a global action plan was launched, and when countries were asked to develop national action plans against antimicrobial resistance, where they would develop a series of key interventions targeting different sectors to stop the spread of antimicrobial resistance. There are a couple of things that you might want to read. There is a report that was published in 2019 by the United Nations Secretary General called No Time to Wait, Securing the Future from Drug-Resistant Infections. And also, I would suggest you to follow the work of the Global Leaders Group on Antimicrobial Resistance. So now let's take a look at the National Action Plan progress. So the first National Action Plans were published in 2017. What countries were asked was to develop National Action Plans, find funding to fund National Action Plans, and then move towards the implementation of National Action Plans. So you'd see that the really dark blue countries are the countries that have a financial provision in place to support the national action plans and have started implementation of national action plans. So you see that the majority of countries are at the stage of having a national action plan, but not having quite reserved the budget for the full implementation of the plan. And the World Health Organization has been working very hard over the past year to try to provide tools to really help countries develop budgets for the support of national action plan. And to be honest, by looking at the map, you would see that there are a lot of countries, low middle income countries, they have significant challenges, that haven't had significant or faced significant challenges with the developments and the implementation of action plans, but also there are a few high-income countries there as well. They are not quite there yet. So the different actions that are needed in order to respond to the threat of antimicrobial resistance includes surveillance, which means collecting, analyzing, and sharing data that gives you information around the burden of resistant infection in the community, in regions and countries. But that's important because if you don't know what the burden is, then it's very difficult to design interventions to stop the spread of resistant infection. So you need to know the problem that you have in your region in order to be able for you to target it. This also means, as a second action, to develop stewardship measure, and stewardship is about promoting the responsible use of antimicrobials across different sectors. Also, new needs to develop national policies, so specific policies that would support the implementation of specific activities aiming again at the responsible use of antimicrobials in the society, as well as we cannot forget the individual action. So everyone has a role. Not only healthcare professionals have a role in working towards stopping the spread of antimicrobial resistance, but also other people that are not necessarily doctors or healthcare professionals can have a role in working towards stopping antimicrobial resistance. So I just wanted to give you with the slides we went through until now. I just wanted to give you a very brief overview of antimicrobial resistance. I know that you already had a few presentations on AMR, but I just thought that gives you a bit of a framing and provides you a bit of understanding of how antimicrobial resistance might be perceived at the community and at the societal level. So we've seen that it's a problem due by the misuse of antimicrobials. Since when antimicrobials were discovered, there was this sense that antimicrobials could be used as magic bullets because they were very specific in targeting infection and in killing bacteria or other pathogens. And so so I just wanted to give you like a very a broad overview. But now let's take a step back and let's try to understand why antimicrobial resistance might affect low middle income countries more, or disadvantaged communities and population. So I want to start with a definition and a definition of the determinants of health. So the social determinants of health are non-medical factors that influence health outcomes. So when you're born as you're an individual, you have a specific genetic makeup that might predispose you to acquire specific conditions or disease, make it more prone to get infections. But the social surrounding and the context surrounding you is actually affecting that's affecting your health as well. So the genetic factor, your age and sex and other genetic factor contributes only a little bit in how your health will develop. And this is important to understand as a concept, because then you realize that if you find yourself in a situation context where you lack access to clean water, to safe food, or to education, then you might be more predisposed in developing certain conditions. And this is a very important concept to explain why antimicrobial resistance has a larger effect on disadvantaged population and why health inequity is so important. So let's look at health systems, and let's look at maybe resilient health systems. What does a health system need in order to work? An health system needs infrastructure, it needs a workforce, it needs interventions, key interventions at the community level, such as vaccination campaigns, other prevention campaigns for cancer, diabetes, etc. It needs investments as well. It needs governance, so a body that will govern how health is provided to the community. He needs community services and hospital services as well. And we already discussed about preventative measure. So now let's look, I don't know if you can see, I'm moving my arrow here, but let's compare high-income countries and lower middle-income countries. So you will see that if you compare the out-of-pocket expenses in low and lower middle-income countries compared to high-income countries are so much higher, which means that people in low-income countries are expected to pay for health. While in high-income countries, health is provided under a universal health coverage. And this massively affects accessibility to health, and it massively affects health in general. If you're expected to pay for health on top of other services and other things that you might have to pay, then you soon realize that only people that can afford to pay for health will be able to access health. And then obviously translates in people might dying or might acquiring disabilities because their inability to access health. There are some high-income countries also that struggle with the provision. They are challenged with the provision of universal health coverage. But low middle-income countries have disproportionately been affected because of other competing health priorities. So there is not only antimicrobial resistance as an issue, but there are other very important health issues, such as malaria, such as HIV, and other things, and needs to be paid for. And so very difficult decisions needs to be taken at the ministry level to decide how much money can be provided, can be given to support health at the population health level. Let's look now at another issue. So we look at the issue of assessing health, disproportionately affecting people. I forgot to mention that obviously if you have an infection, that means that you might have to pay out of pocket for antibiotics. And so if you have to pay out of pocket for your antibiotics, sometimes certain families have to take very difficult decisions. They either buy food or they buy the antibiotic. And so you'd see that can massively affect health communities. And in some situations, they might even be able to get those antibiotics, not from healthcare professionals, but from markets, with the risk of because maybe markets that are cheaper than buy from the healthcare professional, from the pharmacy, and buy antibiotics that are not regulated, can expose people to very high risk of getting counterfeit antibiotics, so fake antibiotics, or antibiotics that do not contain the right dosage of the active ingredient. And so you can see how the context around you and whether healthcare is provided to you can massively affect your health and how diseases will spread in the community. So now moving to another example, access to water and sanitation. So access to safe water is a basic need. Sorry, I made a mistake. I said lack of access to safe water is a basic need. I meant access to safe water is a basic need. And we know that around 2 billion people in the world lack access to safe water. And unsafe water contributes to the spread of infectious diseases. And it's one of the major causes of poverty, and disproportionately affects women and children. So let's look at some data. In 2020, 5 million children under 5 died. According to the data that I found, Nigeria has one of the highest mortality rates. And if you look at the first graph here, this tells you the percentage of people without access to safe drinking water. And you'd see that in sub-Saharan Africa is an average of around 40 to 50% people do not have access to water. And then if you then look at the graph next to it, which basically presents to you the life expectancy and infant mortality rates in countries with limited access to safe and drinking water, you soon realize that access to safe water is a leading cause of mortality. And why is that? Because pathogens can spread through unsafe water, and that can cause diarrheal disease. And then if you couple it with the inability to access to healthcare services and ability to purchase antibiotics, then can obviously have devastating effects. And the devastating effects in this case are measured with child mortality. So another issue that we encounter when we think about unsafe water, we just saw how our water plays a role into the spread of pathogens, and obviously how that massively affects communities that live in environments and contexts where access to safe water is not possible. But let's also look at other things that can spread through water. So you have pathogens in the water, and those pathogens can be also pathogens with resistance. They can be bacteria with resistance. You can also find antibiotic residues in water coming from farms, coming from hospitals, but coming also from manufacturing pharmaceutical facilities. And you'd be surprised to hear that there is not really a clear regulation that regulates the amount of safe antibiotics that can be found in water. There is not even a clear regulation that controls the amount of bacteria also found or monitors for resistant bacteria found in water. And this is the same in high-income countries and low-middle-income countries. Now, a lot of high-income countries use wastewater plants. Wastewater plants are effective in removing certain pollutants, but they don't remove all the pollutants. They might not remove all the antibiotic residues, and they might not remove all the bacteria pathogen. They are actually not set up to recognize bacteria, resistant bacteria, and remove those bacteria from wastewater. So wastewater will obviously spreads in the environments, being released into rivers and into seas, and obviously people accessing water from river or sea might be affected, and it's been shown that they are affected by antibiotic residues and resistant pathogens in wastewater. So there have been a number of studies that have showed that communities living near antibiotic manufacturing facilities in India show a high level of resistance for they've been affected by resistant infections related to the antibiotics that are produced by the nearby facility. So it's clear that there is a role for the spread of antimicrobial resistance in the environment. And since the regulations are so lax, then you understand that it's very difficult to control the issue. So there is a very interesting case studies that we look at, and there was a case study in India. So India was meant to develop the first ever national standards to limit the concentration of antibiotics in wastewater discharged from manufacturing facilities. But unfortunately, that regulation, that policy was stopped, and it didn't go through. So Again, this is giving you another example of the role the environment, the surroundings can have on your health. Let's move again to another example, neonatal sepsis and access to essential medicine. So babies are more kind of prone to get infections, and they're more prone to develop sepsis. I don't know if you know what sepsis is, but sepsis is an infection that spreads in your blood and affects all the organs in your body, and it's extremely dangerous and needs to be treated. It's a medical emergency. It needs to be treated with antibiotics. It can cause organ failure, and it can lead to death. So babies are most affected by sepsis because they don't have a fully developed immune system. So if you don't have a fully developed immune system, then you're more prone to getting infection, and you're more prone to getting severe infections. Sepsis affects all babies in the world, but sepsis in neonates in Africa is one of the leading cause of death in Africa. And GARD-P, which is an international organization, ran a observational study for neonatal sepsis. They ran this observational study across 19 different sites in high as well as in low middle income countries to collect different type of data and also compare the situation in high income countries with the situation in low middle income countries. And basically one of the key results and key gap is the ability to access to essential medicines, to essential antimicrobials when they're needed, specifically to treat a sepsis in babies. And unfortunately, a lot of countries in low middle income countries struggle with the ability of accessing specific antibiotics, which means that a lot of time doctors need to resort to other type of antibiotics, might not be the right antibiotics to treat that specific infection. And that can cause antimicrobial resistance, that can cause also worse outcomes in patients, and in this case, babies. Access to antibiotics is a known issue I have to say, in high-income countries as well, specifically due to the rupture of antibiotic supply chains, but also and more specifically in low middle income countries for different reasons. One of the key reasons is around procurement of antibiotics. So the ability of a country to procure the necessary antibiotics for their community, but also the purchasing power. So the ability to be able to pay the correct price that the manufacturing facility or the pharmaceutical company is asking for securing a specific antibiotic. And so antibiotic access not only affects availability, but also drives misuse, because as I was telling you, it kind of pushes doctors to potentially switch to antibiotics that are not the correct antibiotics for that specific infection. And we didn't discuss that one of the reasons when we look at supply chain of antibiotics, I don't know if you were aware, but most of the antibiotic ingredients and formulation actually come from China and India, which means that if there is an issue with the supply chain in China, the repercussion of the supply chain issue, manufacturing issue of a specific antibiotic will be felt globally, all around the world. And also because the reliance on of countries on manufacturing is a heavy reliance on these two countries. It means that in a way countries as well are competing against each other to procure enough antibiotics for their communities. And as it happens, biggest orders will be fulfilled first. And this has happened in high-income countries as well. So I'll give you a very simple example to put things in context. So you have the United States, and they want to buy antibiotic A from China. United States has a high reliance on antibiotic supply from China. Around 95% of their antibiotics are purchased from China. So they put in an order through, and they're putting through a very big order. And then you have a smaller European country, and they're putting through a smaller order because their population is smaller, or they don't need so much of the antibiotic. Well, at the manufacturing level, it makes more sense for that company to fulfill the US order first, because it's a much larger order than the other one, which means the other country has a desperate need for that specific antibiotic because they have an outbreak. They might not be able to access the antibiotic because their order is a small order. So has been put second to the biggest order. And this is a problem that a lot of countries face, and this is the problem with procurement. And then you see that in low middle income countries, they have a lot of other competing priorities, procurement of different drugs. They have different disease burdens. They have HIV, they have malaria. They have to spend money on a lot of different things, and it becomes very very complicated. And also, as we've seen at the beginning, the lack of surveillance data that can give you an estimate of the burden of disease. So it gives you an estimate of how much drug you might need to treat infection in the community, also can make a country procure less antibiotics, and which then translates with the unavailability of specific essential medicines. And another issue that I would like to talk about and finish my presentation with, it's gender, and how gender disproportionately affects the spread of antimicrobial resistance. So pregnancy, and pregnancy, abortion, childbirth, access to healthcare settings without safe or hygiene conditions, or lack of access to safe water, obviously puts women at an increased risk to acquiring resistant infections. Also, the role of women and responsibilities that they have within societies and communities increases their risk to acquire resistant infections. So 70%, apparently 70% of people in the health sectors are women. Obviously, if you work in the health sector, you are more prone of acquiring infections. There is a lot of power inequities that affects women and affect women that work in healthcare settings. So if they work as doctors, nurses, pharmacists, they might not be listened at as much as men do. You might think that this is crazy, but in reality, it's the truth. And so women that demand change within healthcare settings might not be listened to, and they might change to improve better infection control, and things might not change because of these power inequities that still exist. And they are more frequent in certain settings. Women are often formal and informal caregivers in communities, in families, or in the healthcare sector as well, and that increases exposure as well. In general, women get prescribed more antibiotics. One clear example is urinary tract infections. Urinary tract infections are more common in women, which means that women will be prescribed more antibiotics in general. There are studies that confirm that women with resistant infections are less likely to receive or be able to afford care. So to be able to pay for care, but also to be listened by doctors about their concerns. There is a lot of gender based violence in specific settings, in war settings, in refugee camps, where women are subject to rape, unfortunately, and that means they are more exposed to acquiring sexually transmitted infection. And also, in some contexts, women play a very important part in raising and keeping animals, so in community farms, or and that means that they will be exposed to also acquiring resistant infection due to the widespread use of antimicrobials and antibiotics in farming practices. What I would like to conclude with today is, so just to summarize, I hope I was able to get the message across about how antibiotics have been perceived through histories by communities that have been perceived as those magic bullets that they were able at the beginning, when they were discovered, they were able to treat any type of infections. Then as soon as antibiotics became used widely in the community, healthcare professionals soon realized that bacteria and other pathogens were able to acquire resistance against those treatments. And then they soon realized that antibiotics, they did not have an effect only on individuals, but had an effect on entire communities. And so the misuse of antibiotics across different sectors as growth promoters in the animal sector, so as preventative measures in human, animal, and environment, and actually caused throughout the years a lot of damage. We also seen how specific social determinants of health can affect health of communities and populations. So it's not only about how you're born, so your gender, your genetic makeup, but also where you're born. So the context, the social context, and the accessibility to specific services does affect your health, and does affect how infectious diseases spread in the community, and affects also whether you'll be more likely to get a resistant infections or not. We saw that the lack of universal health coverage is a big issue. It translates with the fact that people will need to pay for assessing treatments, assessing health, and that means that difficult decisions sometimes needs to be taken by families, whether they will be able to buy antibiotics or foods. We've seen examples in how low middle income countries are affected by specific issues, such as lack of access to clean water. We saw water as a mean as a mean that can spread infectious diseases within the community, but also can spread resistant pathogens within community. We saw how specific issues had devastating effects in low middle income countries, such as neonatal sepsis, because of the fragility of health system, and also the lack of access to potentially the right antibiotics when they are needed, and also the role of gender and the inequities that is affecting women, especially women in specific context. So now what I would like to conclude with, it's a bit of a call to action. And we saw at the beginning that some of the key activities that are needed to stop the spread of antimicrobial resistance also should come from individuals. And not only healthcare professionals, but also individuals without a science background. And what I would like to stress here is the power of storytelling. Everyone has the capacity to narrate a story, and perceptions from different people within the community affected by infectious diseases and resistant infections are actually needed to really get the message across. Antimicrobial resistance is a very difficult concept to understand. Has been explained as a very scientific, and I think that until now, somehow the experts have failed to communicate to the public and to communities what antimicrobial resistance really means. But things are changing, and so what I would like to stress here, that everyone has a role in this. Everyone can contribute, and so it doesn't matter whether you're starting to become a doctor, a nurse, or pharmacist. If you're starting to become a lawyer, to become an anthropologist, to become a psychologist or an historian or anything else, there is a role for you. Anyone can bring something to the fight against antimicrobial resistance, and let's not forget the importance of storytelling, narrating issues that affect your community, that issues such as infectious diseases and antimicrobial resistance affecting your community. And so this is a call to action for all of you to really try to grasp this issue and run with it and take action. So I'm going to stop here. This is my last slide. I've shared my email address. Please do reach out to me if you have any questions. I am also on Twitter as well with Francesca Chiara, and do follow as well the work of CDRAP. We publish news related to antimicrobial resistance every day. We also carried out specific pieces of research. The news that we published they can be accessed by different audiences. We don't only write for healthcare professionals, but we also write for patients and the public in general. And thank you very much, and I'm looking forward to your questions.
Wow, thank you very much, Dr. Francesca. This is Anastasia. So, probably we could dive straight into the questions. So our first question, but the rest of the ambassadors, feel free to raise your hand. This question was raised in the chat during the session. So our first question is from Dauda Zakaria. And he says, I enjoyed how you made it obvious that embracing preventative medicine can help drastically fight AMR. My question is, do you feel AMR can be eradicated, or do you feel it can just be mitigated?
It can be mitigated. It cannot be eradicated. So unfortunately, if we think about bacteria naturally develop resistance. That bacteria are living organisms, and so they evolve with time, and they naturally acquire resistance to antibiotics. In the moment they're exposed to drugs, they're living organisms, they change, and they acquire resistance. But they can also lose resistance, like a bacteria that is called E. coli can lose its resistance if it's not exposed to antibiotics. So there are definite measures that we can take to mitigate the spread of infectious diseases and the spread of resistant infections. So vaccines are an obvious preventative strategy, but most simply, and we just saw it, clean water. So if you have access to clean water, then you're ready. So we saw child mortality due to the lack of access to clean water in sub-Saharan Africa. Again, if you take that away, then you would save a lot of lives just by giving access to safe water that does not contain pathogens, microorganisms, or other pollutants.
Thank you, Dr. Francesca. Okay, let me continue looking in the chat for more questions. You're receiving a lot of thank yous, so thank you really. I think the ambassadors are happy. This was really a wonderful session. Thank you so much for your time. Okay. Oh yeah. So yeah, more thank yous. Thank you. Thank you. Thank you. Yeah, so thank you so much. Then probably at this point in time, I would have handed over to Daniel, but he passes on his apologies. Something happened and he's not in position right now to share his thank you. But oh yeah, it came already. Thank you. Yeah, and you're receiving more and more thank yous. So it's exactly 1 minute to 8 p.m. GMT +3. At this point in time, I would also like to add my voice to the many thank yous that you're receiving. Thank you for your time and for being willing to share your knowledge with us. Yes, so probably right now I'd like to hand over to you if you have any words you'd like to share with us before we wrap up the meeting. Yeah.
I mean, I would like to add that I understand that this is a lot of information, and I can see, I'm approaching this from a science point of view, and sometimes, when you're a scientist, it's difficult to relate complex information, and so it can be daunting. But I mean, take your time and think about what you heard from me today, from the other presentations as well, and come back in the future if you have further questions. I'm always available to respond to anything, to any doubts that you might have. And we have a long-standing relationship with Daniel, myself, and my colleagues at CDRAP. We participate in other programs, and we always enjoy the interactions with the different students. And so, always very, very happy to further interact and provide additional material as well if needed.
Thank you so much, Dr. Francesca, and the thank yous continue in the chat as well. Thank you for your time. Thank you for being willing to be here today. Thank you, ambassadors, for joining in. So I wish you all a wonderful evening or afternoon, depending on where you are. Yes, okay. Thank you, everyone. Have a wonderful rest of your day.
Thank you too.
Thank you so much.
Bye.
Thank you.